Good afternoon. My name is Corina Herrera Loera, Public Information Officer here for the Santa Clara County Emergency Operations Center. Welcome today to our community forum for an update as to COVID and how it is here in our county. We will be having Dr. Gerardo Solorio Cortez, but before we bring him in as our special invited guest today, we will be giving an update as to our counties and what our current numbers and information tells us. We have Gloria Pacheco helping us in the background. Gloria, thank you so much. If we can go to the next slide, please. So the COVID-19 daily update, this one is as of December 7th. 78.9% of the residents of all ages have completed vaccination. And as of that date, it was 181 new cases with a 7-day rolling average. It is important to highlight that today, the new rolling average, which will be posted tomorrow, is 222. So the numbers are raising. Next slide, please. And also, before I go into this slide, I just want to remind our audience that we're here to answer questions. Our Dr. Solorio Cortez will be presenting as soon as I'm finished, and we will open it up for questions and answers at the end of his presentation. So please put down your questions related to our topics for today, and we will be happy to respond in the order received, and hopefully we can get through all of them. So here is our slide, which shows the difference. For me, it's very important to highlight the difference between being vaccinated and unvaccinated. So here we see the COVID-19 case rates by vaccination status. And so if you can see on the unvaccinated case rates, ages 12 and up, 51.1% were unvaccinated of the cases, of the COVID cases, and 5.1 were fully vaccinated. So what does this tell us? There is a big difference. You know, the vaccine does make a huge difference in getting COVID-19. And although, as you can see, 5.1 are fully vaccinated, the symptoms are very different. So the severity of the symptoms with those who are fully vaccinated are not as severe as those that are not vaccinated. So we don't see those vaccinated ending up in the ICU, on a ventilator, or even dead. And so that's very important to highlight. Next slide, please. And so as we know, and we've heard, we have the vaccines for everyone now, ages 5 and up. The important detail on the ages 5 to 11 is that it's only 1/3 of the adult dose. So it is a lot less. The dose that the children will receive is a lot less. The adolescents, 12 to 17, are also up and are able to get their vaccine. And the boosters are available now also for the those 18 and over. So if you see here on the page, Pfizer is the one that's available for everyone, including the children. That is the only one that's been approved for children. And then Moderna and Johnson & Johnson have been approved for 18 and over and for the boosters. So if you've received your vaccine full dose 6 months or longer, then you are able to get your booster shot. So make sure you get your appointments and go get your vaccines. I know a lot of schools are also having vaccine clinics. So you are able to go with your child to also get your booster during those clinics. Next slide, please. And here, why should you get your child vaccinated? So some of the children do get severe complications from COVID-19. Children can also spread COVID-19 to other people, even if the child does not have symptoms. And so the vaccine is the best protection that we know as of yet. Vaccinated children will be able to also participate in more activities and attend more events. And so, those are some of the reasons why we should get your children vaccinated. Next slide, please. And on this one, just a reminder to bring your children's yellow card that we have as parents when we get their vaccines. There's a list of them. And so bring them if you have it and you have you're going to get your child vaccinated so that it can be included in there. If you don't have it, don't worry. Don't cancel your appointment. Still go. You will receive that white card. And it will be included in your child's records for the vaccine. But if you do have it, please bring it with you. Next slide, please. And so again, reminder to get boosted. Those of you that are 18 and over are eligible. Those that have received their vaccine 6 months or more. And where can you get your booster? All county vaccination sites offer the booster doses, including the drop-in clinics. And so you could also visit sccfreevax.org for appointments if that works best for you, or drop in at one of our drop-in vaccine clinics. Next slide, please. And then also information on emergency rental and or financial assistance. There is financial assistance, a one-time payment of up to $2,500 for qualifying families, or $2,000 for qualifying individuals. Rental assistance also can include one-time payment of up to $5,000 or 1 month's rent and utilities. So if this is something that you feel you might need, or you have a family member or a friend, please take down the information and get this information to them. You can visit sjhousing.com or 408-795-4444. Once again, the phone number is 408-975-4444. Thank you. Next slide, please. And then these are helpful resources that, I like to highlight. We never know when we might need them. And so there's a general COVID support line, 408-808-7770. COVID test or vaccination appointment, you can call 211. Know your rights in the workplace, 1-866-870-7725. To report a COVID violation, 408-961-5500. To access mental health services through our Santa Clara County Department of Behavioral Health, you can call 1-800-704-0900. Substance use services, 1-800-488-9919. Or crisis hotline, which is 24 hours, 7 days a week at 1-855-278-4204. Or you can text RENEW to 741-741. Next. And so these are additional slide with phone numbers if you didn't get to write them down. And you only remember 211, feel free to take that down. We know that, this pandemic and this time affects us all very differently. It has not been easy, whether it's an adult or a youth or a child. So we just recommend, to have these numbers available in case you ever need to access them, and any of the services and resources through our county. Next slide, please. All right. Thank you so much, Gloria, for helping with that. And now I'd like to welcome our Dr. Gerardo Solorio Cortez. Welcome, doctor. I know you have updates. I know, some of us have heard things in the news and we might be a little worried. So we're happy to have you back. And so if you could please give us our updates for today. We appreciate it. Thank you.
Definitely. Thank you. Good afternoon to everyone. Thank you again, Karina. And yes, I believe the biggest news or what's happening now with COVID-19 pandemic is on the issue of variants, and specifically now talking about the variant Omicron that was first detected in South Africa a few days ago. So it's an evolving news, meaning that day by day we're learning more about what this means. Um, just to back up a little bit, as we know, as we moved on with the pandemic, and we, in a way, knew this in terms of variants. So initially, there was the original virus coming out of China, and then from there, subsequently, we learned about variants in different communities or countries or places. We know about for example, the Alpha, and more recently, the Delta. So now we're talking about a new variant. So the biggest question now for us is to figure out if it's number one, going to be more transmissible than the previous variants. Number two, is it going to cause more severe disease compared to the other variants? Number three, do the vaccines are they going to be effective with this new variant? Either the antibodies from the vaccines that we make, or number two, also for people that have been infected previously with COVID-19, are they protected with their antibodies for this new variant? So day by day, we're learning more about it. What we do know is there's about, and I don't want people to get too worried about the numbers, but the exact science says there's about 50 mutations in this specific variant. 32 are involved in the spike protein, and as many of you may know, this is an area of the virus where the vaccines or the antibodies that are made the vaccine works. So that's why I mentioned a few minutes ago. In a few days or weeks, we'll find out if the vaccines that we've have thus far are effective against the new variant Omicron. At this moment, there's no, I would say, as President Biden has mentioned, no reason to get very alarmed. We need just to be very smart about it, learn more of what it means, and what how is it going to affect populations. So day by day, we'll find out more about it. It's still no matter what it is, we're still gonna recommend the basic fundamentals of what we've always recommended throughout this pandemic, which is good ventilation, the masking, uh, good hygiene, and of course, as Karina has mentioned, data, you could see that vaccinations do work. And if you are greater than 5 years old and you're eligible for the vaccine, please get vaccinated. Furthermore, if you are due for your booster shot, please get vaccinated as soon as possible. Um, so yeah, I'm here. If anybody has any questions, thank you.
Thank you so much, Doctor, for that update. So what I'm going to do is I'm just going to go down the list of questions here. And remember, Dr. Solorio Cortez is here to answer questions regarding our uh, topic for today, which is more of an update and what we have, right? What you have. Thank you for sharing that with us. So I'm going to start with Sean Thomas Villafana, and it's not really a question, it's more like a comment, but I'm thinking he's asking a question. If you know anything about the Israel study that found over 60% new cases to be vaccinated. Do you know anything about that, doctor?
I do not, but I think it's important, and that's why I think um, when I mentioned the comment of we're learning as we go. Um, at this moment, we do not know if, let's say, you are vaccinated and it's not as as effective as previously. The question would also is also going to be: is it going to be? Is it a mild case? Is it a um, severe case? Does it land you in the hospital? Just this morning, I was reading an article, and I have yet to confirm, but and that's what I'm saying. That even when all the scientists around the world will publish, inform the public in terms of what are they seeing. So I think South Africa might be seeing more mild cases. So it may be that, for example, this study might show that there are cases, but mild cases versus the what we're very worried about is and that's what we don't know. Is it going to be a severe case? And furthermore, are these cases going to end up in the hospital? I think that's one of the reasons why Dr. Fauci and President Biden um, made that travel restriction, because it's more of buying time and getting more data of how transmissible and also how severe it is. We want to do our best using science to prevent surges. As you could all probably know, that there have been 4 or 5 surges since this COVID-19 pandemic has started. So working together, collectively with world health professionals, scientists, we're trying to see how we could best prevent those surges.
Thank you. And the next question um, we have Iodos Doko, welcome, who says, hello, is Santa Clara County discussing free or discounted at-home COVID test kits, or as other states are starting to provide? Do you know anything about that, doctor?
I am not aware,
Okay.
but
Yeah,
I would see how it's an excellent idea, definitely.
definitely. And I'm not aware as of now either, but I'll go ahead and also find out and maybe have an update at the next community forum. And we have Christy. And Christy Garrison is wondering, why is the focus on case rates and not hospitalizations? Why is this data buried on the county dashboard? Wasn't keeping hospitals from getting overwhelmed the whole purpose of closures and is a reason for masking, etc.? Any thoughts, doctor, on that?
I mean, I think it's an excellent point. At this moment, I'm not aware that again, we're trying to prevent the surges and hospitalizations. I do know that in other states like Michigan, they are really suffering right now in terms of it's not only the cases but also the hospitalizations. And in fact, in those hospitals, there's a limit to the elective procedures that are being done to make space for the active, severe COVID-19 cases and hospitalizations. At this moment, at least, in the hospital that I work for, the county that I work for, we're not at that level yet. But for sure, it is one of our data points that we look at for sure, to determine, do we need to do more, like the word lockdown. But at this moment, again, it's more of we're getting more data. We're still recommending the masking, the vaccinations, and also we want to learn more about what the new variant Omicron means to us.
Mm-hmm. Thank you. And then also, my understanding is the fact that we have more uh, members of our community vaccinated, that number compared to the number of those that are in the hospital, um, we're not at a worrisome place right now because of the numbers that have been vaccinated. So as I understand it, however, like you said,
Yeah,
it's something that we have available and that our
right,
experts are looking at, to see if that shift changes. Hopefully, we don't have to go back to a lockdown or anything like
right, right. I mean, if you were to, if that question is being asked of me, and if I was a Michigan doctor, I would answer differently. I would say yes. At this moment, elective surgeries are on our hold because we have um, too many cases. And if you look at the vaccination rates, there is a difference between many states across the United States, when some of them would be like in the 40% general as a general population, and us being in the 80s and such. That makes it's making a huge difference. And you're looking at the hospitalizations, where people that end up in the hospital are those that have not been vaccinated. And also the booster is very important, meaning that if you're due for it, please get it as soon as possible, because studies have shown that, or the small studies that have come out, a two-shot series vaccine versus the boosted person, the boosted person's more protected and less likelihood of it ending up in the hospital.
thank you. I'm going to go to the next comment here. We have Lauren Sanchez, who states, I brought my child's yellow vaccination card for the first dose at BMC, and they didn't fill it out. They said they didn't have a stamp for it, and the white card was all I needed. Perfect. Thank you, Lauren, for that update. And yeah, you know, that white card is all we need. And I know that for me, my daughter's, I have her in Kaiser, so I just took that card and brought it to Kaiser, and they included the vaccination on her list. So thank you for that update. We have Rita Moreno Apolto. Welcome. Can you remind me on how long it's recommended to isolate for vaccinated individual that tested positive, doctor?
It's still a 10 days. It's a case by case too. For example, if the patient is hospitalized and is in the ICU, that day could be prolonged up to 21 days. But in general, it's 10 days.
Thank you. Right. And next one, we have Familia Galvez Quiroz. If someone got vaccinated in Mexico with the Cancino vaccine in March, can she get a booster shot here? And if so, which one?
Excellent question. We actually our system is very our doctors here, specialists, help us a lot, and that we have a diagram, and it was emailed to us. So yes, there is. Well, the answer is we have to look at the actual the type of vaccine, and I'm sorry that I do not recall if Cancino was one of the WHO approved vaccines, because that makes a difference. If it is, for example, then the recommendations is that you do qualify for a Pfizer booster vaccine 6 months after the last shot. Um, for example, this past week, I had a patient from another country who did have a vaccine that was World Health Organization (WHO) approved. So 6 months after the last dose, they they were able to get the Pfizer booster vaccine. Now, for a vaccine that's not approved WHO, then technically, if you want to start, and then you know that you're not going to go back to that country, and you want to start a series, then you're eligible to start the series as well.
Thank you.
Oh, so I would my answer to your question is definitely talk to your primary care clinician, or even at the vaccine sites. There should be a little infogram for the vaccination site to let you know, for us to go down the list of which vaccine you got, and then from there let you know if you qualify for the uh, Pfizer booster or not.
Hmm. And I would just add, if you want to call ahead, call 211 and talk to somebody, and ask some of these detailed questions, feel free to do so. So once you go, and you let them know because they're still going to have to go, like Dr. Solorio Cortez mentioned. They got to, when you show up, they have to make sure they ask you certain questions and go through. But at least you're already aware of what that might be. So feel free to call 211. And then we have Iodos again, who says, "Thank you for looking into it. This is fairly recent coming from the White House. Only a few states have been leading the front on this." And then she mentioned initiative. Thank you, Iodos. Um, and next we have Rita Moreno Apolto. Also, after testing positive, how long do you need to wait to get the booster?
Excellent question. Um, Generally, it's 10 days. And the caveat would be, for example, if, or the exception would be if you were to be admitted, and for example, you're in the ICU, then it might be, 21 days. And then the doctor will let you know. But in general, it's 10 days. So after 10 days, you're at home, you self-isolate, and you get out of that the quarantine period 10 days. Then on day number 11, if you wanted the vaccine or booster, and then you qualify for that time, then you will be able to do it. um, and let me step back. So we know just from looking at data that um, within the 90-day period after infection, it's very unlikely that you'll be reinfected with that same variant that's going around, and that's why it's always been a statement that it's very unlikely that you'll get reinfected. So you are protected. You could wait, but it's still the CDC says if the patient wants 10 days after finishing quarantine, day number 11, you're set to go and you're able to get that vaccine or booster. And if, of course, looking at the days of when was your last um, vaccine. For example, if it was vaccine for Moderna, if it was you got it uh, 10 days ago, the vaccine, for example, or let's say 15 days ago, and they got infection, you still got to wait, 28 days from initial vaccine. So don't want to confuse people, but in general, it's as long as you're out of the infection period 10 days, and also, of course, that you meet criteria based on the vaccine, either the booster or the second dose series shot.
Thank you. Thank you, Doctor. And we have Tino Garcia Barragan, who is asking, why are there different recommendations for the injected and those declining the shots if everyone can get infected and spread the virus? People are losing their jobs over this.
Yeah, I think this is more of a public health um, you know law question. What's right, what's wrong, disease, infection or not, and also we understand that people have jobs. So I'm actually assuming a lot of things in this question.
Right.
We're talking about like the mandates for private work. Why is it, for example, that someone would be quarantined, or after being exposed to someone that's vaccinated doesn't necessarily need to be quarantined versus someone who is unvaccinated and is around someone with close. Why are there differences in all that? um, I think the bottom line is that the science is driving public health and law decisions. We want to keep as many people as protected. I mean, I'll just give you an example. There's some people, for example, that are immunocompromised that will get the 3 doses vaccine and still not mount a good normal protected response. So then you know we're trying to, I think, lawyers, public health officials are trying to get all this information and come up with a solution that would, uh, by all means, make sure or prevent disease, prevent infection, and prevent deaths. So I think that's why, and and you can also see this in everyday, sports, NFL, NBA, and you'll see this differences of why this and that, and a lot of times it also has to do with
Oh no, you froze. So I'm not sure if it's your internet. But I think we got your point, Dr. Solorio Cortez. Thank you. You're back. Yay. uh, and I think the important thing is to realize that there's facts and there's myths, right? There's things
Mhm.
that people say, or this happened to my neighbor and somebody I know, and there's facts. Here are the numbers. Here, here's what's guiding the decisions. And so that's important to understand that there are facts that are guiding decisions. Um, like you mentioned, right, in leadership. And I know this question kind of, was left open. It could be maybe different recommendations for concerts, right? But I think
Right.
again, regardless of what that, the question was surrounded around, it was based on facts. So based on facts, then the recommendations are given, and there's different rules and laws. So as we know, those that are unvaccinated versus those that are vaccinated, there is a huge difference in numbers, and those that are getting COVID and the symptoms and the severity. And so thank you for that explanation, doctor. And I'm glad you're back. I was like, I think I can answer the others, maybe not. Um,
Good.
we have, I hope I'm saying it right, Pong Dong here. And they're asking, is there more data regarding possible pregnancy loss, miscarriages with the vaccine, or data on pregnant women who got the vaccine? Do you know, doctor?
Yes, I mean, I think at this point, similar to, the alert when Johnson and Johnson's alert with the um, blood clots and the clotting in the brain, that was a few months ago. I have faith and confidence in the FDA, CDC's alert system. And I give you that backstory because at this moment, the data, the real life, what's happening is telling us that COVID-19 could lead to worse outcomes in women who are pregnant. So, hands down, and furthermore, the American College of um, Obstetricians and Gynecologists came, and also like other organizations came out with a strong statement said the benefits of the vaccine in women who are pregnant outweigh the risks. And furthermore, what I'll say is if any bad outcome and talking about miscarriages, if more of them happen after vaccination, I have faith in these system with CDC, FDA. If we would have seen that, we would have come up with an alert, and it's the total opposite. It's like, no, we recommend highly that you get vaccinated because we know the science does show that real COVID infection in someone who's pregnant leads to bad outcomes in mother and baby.
Thank you. And then we have Iodos again, who is asking why, I'm sorry, will new vaccine formulations come out next year that don't require so many shots? Do you know, doctor?
Excellent question. Yes, I am aware that different pharmaceutical companies and even universities are utilizing different modes of making vaccines. So, do I think that there might be another vaccine, different technology out there that's been tested and will be FDA and CDC approved? Yes, because I know there is those shots being approved. Now the question about will there be one shot that gets all? That's up in the air. I mean, I'm sure there's science and scientists and research labs are working on that. Or will it be more of a booster shot similar to a annual flu vaccine that we all get or that's recommended? So it's still unknown, but I do know that we have a lot of hardworking scientists, researchers that are working on that. Um, we want to make something that's safe, efficient, and of course convenient as well, if it's possible.
Mhm. Thank you. And we have the same person asking, I have relatives from Europe coming to visit the Bay Area next year. They are fully vaccinated with AstraZeneca. Are they considered fully vaccinated by California and or Santa Clara County?
Excellent question. So I actually, sorry, I'm looking at my infograph. So AstraZeneca is actually it is a WHO approved vaccine. It's not FDA approved, so that's what I know. And now the question would be, um, also, would you qualify for a booster? And this individual, they would qualify for booster after 6 months. Um, but the I know you're asking the question about. I do not know um, the answer. I would say WHO does, is more of a world organization that kind of dictates population. So it is one of the approved WHO vaccines.
Okay, thank you, doctor. And we have Rita who said thank you. Thank you, Rita. And we have David Montel here who is asking, why aren't preventatives like hydrox, ivermectin, etc., used, or at least at the beginning of stages of COVID 19? Why isn't natural immunity considered after having COVID 19 over a vax?
That's an excellent two questions for the hydrox and ivermectin. There's been studies done, last year in various parts, and it I think there was some enthusiasm or some positive uh, um, feelings about those medications, but none of them panned out. Meaning, doing the studies, randomized and looking at them, there was no benefit. There's actually more side effects associated with it. I mean, I do understand that certain people, and I've seen it in like stars, TV stars that tried it, and so, or I have heard. But in terms of the science and what I see in my clinic or what I see in my hospital, where these medications are tried, they're not tried because the science hasn't said that they're beneficial. We always look at the risk benefit question, and right now the risks are greater than the benefits. And the
Thank,
last question about why isn't natural immunity considered after having COVID-19 over the vaccine? This is one question that I asked myself as well, but the science backed it up, meaning that there was reinfection in people that were infected in past, not vaccinated, versus people vaccinated who were infected in the past. And the data looking at those, the individuals who were infected and then vaccinated had less likelihood of becoming reinfected for a second time versus that were not vaccinated. Those were the not vaccinated had more infection rates. So the science backs it up as well, and that's been shown with multiple studies throughout the world. And it's looking at um, the PCR, nasal study test that we do, and of course, in looking at the symptoms of the patients and those that were not vaccinated a second time, they were able to get COVID-19 infection.
thank you, doctor. Okay, and just reminding, we have doctor here answering questions. So I'm looking for the questions, making sure we make good use of the time. We have Tino Garcia Barragan again. Is there a difference in liability for adverse events and deaths from the shots between BioNTech versus Comirnaty? And if so, do you know how many shots of the Comirnaty brand have been issued? I know we're not talking about any of those today, so but I'm not sure if you have information on that offhand, doctor.
I don't. Sorry, I do not.
Yes, thank you. All right. And I don't see any other questions here. Thank you so much for joining us. I really appreciate your time, Dr. Gerardo Solorio Cortez, and doing your best to answer all the questions. And if we don't have, the answers, stating that we just don't have them, or we're going to look into them and bring them back. So I look forward to looking into some of the information that was provided here and bringing back information, especially, those at-home tests. Kids,
Definitely.
I think was
Right.
mentioned. It's something brand new that that was announced as the United States of America, and it's trickling down. Sounds like to the state. So I look forward to maybe seeing if that's something that comes to Santa Clara County. Thank you everybody for joining us. Any last words, Dr. Gerardo Solorio Cortez, for our audience today before we close up?
Pretty much, I think I wanted to say that at the beginning, and that's get vaccinated, vaccinated. With the new variant, no matter what, science is telling us that those that are vaccinated are protected more than the unvaccinated.
Thank you so much. And we'll see you here in 2 more weeks with in conversation with the community. Please continue to join in. Let folks know that we're here to have a discussion and answer any questions that we might be able to answer. And again, we're grateful for Dr. Gerardo Solorio Cortez, not just because he's a doctor and is here available, but is also very connected to our community, which is important for the rest of us when we're connecting and listening to a doctor. So thank you for everything you do, doctor. And we'll see you in about a month.
Sounds great. Thank you so much.
Thank you. Take care.
Right.